Hi, I am Dr. Saqib Mansoor, and today I will discuss with you brachial plexus injuries. So here you could see this picture. This is the Erb-Duchenne palsy. This is lesion of the upper part of the brachial plexus, where the C5-6 nerve roots are involved. And this picture shows the Klumpke's palsy, the claw hand, where the C8-T1 nerve roots are usually involved, right? So let's go into detail. This is a beautiful picture of the brachial plexus lesions that I will discuss with you in the end with number 1 to number 9 injuries. So the brachial plexus injuries, roots, trunks, and divisions of the brachial plexus reside in lower part of the posterior triangle of the neck, while the cords and most of the branches of plexus are lying in the axilla. Complete lesions involving all roots of the brachial plexus are rare. Incomplete injuries are commoner and are commonly a result of pressure or traction. Stab wounds can cut individual nerves. Injuries to the brachial plexus influence movements and the cutaneous sensations in upper limb. So, signs and symptoms are dependent upon part of the plexus involved. Brachial plexus injuries result in anesthesia and paralysis. Right? Testing the patient's ability to carry out movements evaluates the degree of paralysis. In a complete paralysis, no movement is evident. In an incomplete paralysis, not all muscles get paralyzed, so patient is able to move, but the movements are feeble compared with those on normal sides. The movements are weak. Determining the ability of the patient to feel pain, for example, by a pinprick of skin test degree of the anesthesia. So that's the way with it. So the upper lesion of the brachial plexus, the Erb-Duchenne palsy, right? Let's dwell into that, and let me catch the laser first for you. Yes. So upper lesion of the brachial plexus is injuries that result from enormous displacement of the head to the opposite side and depression of the shoulder on the same side. You could see the picture. Here you could see. This is the opposite displacement of the head, and this is the opposite displacement of the shoulder to the other side. So you could see this is the arrow you can see there, right? This is a displacement. This results in extreme traction or even tearing of the C5 and C6 nerve roots of the plexus. It can take place in infants during a difficult delivery or in adults after a blow to or fall on shoulder. And suprascapular nerve to subclavius and musculocutaneous and axillary nerves all have nerve fibers that are derived from C5 and C6 roots and will consequently be showing signs of the paralysis. Yes, the following muscles will be paralyzed as a result in an Erb-Duchenne palsy. The supraspinatus, which is the abductor of the shoulder, and infraspinatus, it's the lateral rotator of the shoulder because of its suprascapular nerve. The subclavius, it depresses the clavicle because of its nerve. The coracobrachialis, it flexes the shoulder. Biceps brachii is supinator of the forearm, flexor of the elbow, weak flexor of the shoulder. These are three actions of the biceps brachii. The greater part of the brachialis, which is the flexor of the elbow, and because of the musculocutaneous nerve palsy. The deltoid, which is the abductor of the shoulder, and and the teres minor, which is the lateral rotator of the shoulder, because of the injury to the axillary nerve. So Erb-Duchenne palsy continues. What is the consequence of that? The upper limb will hang limply by side, medially rotated by unopposed sternocostal part of the pectoralis major. So let's see the picture first. You could see this. This is the Erb-Duchenne palsy, the waiter's step posture. Here you could see all the description. First of all is the medial rotation and the adduction. Right? Adducted. Why is it abducted? Due to the loss of the supraspinatus in the deltoid. The forearm will be in pronation due to loss of the action of the biceps. Here you could see this is a pronated arm, making a vatus tip position. The position of the upper limbs, this condition has been compared to that of a vatus supporters, hinting for a tip, and hence it's usually called vatus tip posture, the Erb-Duchenne palsy. Besides, sensation will be lost over lower part of the deltoid and down the lateral side of the forearm. It is the also, I told you already, upper brachial plexus injuries can also happen in a neonate when enormous stretching of the neck takes place during the delivery. You could see this is a normal delivery, vaginal, spontaneous vaginal delivery, and there is the enormous pressure on the neck. So injuries to the brachial plexus, there can be as well chronic microtrauma to the superior trunk of the brachial plexus from carrying a heavy backpack may result in sensory and motor deficit in area of the distribution of the musculocutaneous and the radial nerves, backpacker's palsy. An injury of the superior brachial plexus, right, C5 and C6, may result in muscle spasm and the severe disability in hikers, which is the backpacker's palsy, that carry heavy backpacks for extended periods of time. And injuries, brachial plexus neuropathy, acute brachial plexus neuritis. It is a neurological disorder of unknown reason that is characterized by sudden onset of excruciating pains. It would be severe pain, usually around the shoulder. Characteristically, pain starts at night and is followed by muscle weakness and at times muscular atrophy, which is a neurological amyotrophy. So the brachial neuritis, inflammation of the brachial plexus, is frequently preceded by some event, for example, vaccination, non-specific trauma, or upper respiratory infection. Nerve fibers involved commonly derived from superior trunk of the brachial plexus, C5, C6. Compression of cords of the brachial plexus can be a result of protracted or extended hyperabduction of the arm during performance of the manual task overhead, such as painting the ceiling. The cords get compressed or impinged between the coracoid process of the scapula and the pectoralis minor tendon. So usual neurological symptoms are the following: numbness, pain radiating down the arm, paresthesia or the tingling, erythema, the redness of the skin due to the capillary dilatation, weakness of the hands, compression of the axillary artery and the vein results in ischemia of the upper limb and the distension of the superficial veins. These signs and symptoms of hyperabduction syndrome are a result of compression of the axillary vessel and the nerves. So that was all about the upper lesions of the brachial plexus. Now the lower lesions of the brachial plexus, the Klumpke palsy. Lower lesions of the brachial plexus are commonly traction injuries caused by extreme abduction of the arm, as occurs in case of a person falling from a height, grabbing at an object to save himself or herself, right? That would be to break the fall, right? You could see this. This is the hyperabduction of the arm. Here you could see this is the angle. This is the hyperabduction. He's catching at a tree while falling. The T1 anterior ramus gets commonly torn. The nerve fibers from T1 segment run in ulnar and medial nerves to innervate all small muscles of the hand. The hand has a clawed look, the claw hand, due to the hyperextension of the metacarpopharyngeal joints and the flexion of the interpharyngeal joints. Here you could see this is the Klumpke's palsy, claw hand, right? Here you could see the position of the, I already told you, right? Not the position of the metacarpopharyngeal and the interpharyngeal joint. Interpharyngeal joints are the flexed and the metacarpopharyngeal joints are extended. This is due to the lesion of the lumbrical and intraossea. So the Klumpke's palsy, extensor digitorum is unopposed by lumbricals and the intraossei, and the causes extension at the metacarpopharyngeal joints. The flexor digitorum superficialis and profundus are unopposed by the lumbrical and intraossei and cause flexion of the middle and terminal phalanges respectively. In addition, loss of sensation will take place along the medial side of the arm. If, say, C8 anterior ramus also gets damaged, Usually it is T1 is involved. If the C8 is also involved, extent of anesthesia is greater and involves medial side of the forearm, hand, and medial two fingers. Lower lesions of the brachial plexus can also be brought about by the presence of a cervical rib or malignant metastasis from lungs in lower deep cervical lymph nodes. So now the long thoracic nerve injury is yet another injury supplying the straightest anterior muscle, this nerve, right? So pressure on or blows to the posterior triangle of the neck or trauma to the upper lateral chest wall, for example, during surgery of the radical mastectomy can injure along the thoracic nerve that takes origin from anterior MI of C5 to C6 to C7, C5 to C7, and innervates the serratus anterior muscle. Paralysis of the serratus anterior causes the inability to rotate scapula during abduction of the arm above the right angle. Consequently, the patient faces difficulty in raising arm above the head. This would be the position, this side, right? This is the right side. And here you see position of the scapula. This is called as the winging of the scapula. The scapula is winged. Where vertebral border and the inferior angle of the scapula is no longer kept closely applied to the chest wall and protrudes posteriorly in a condition known as the winged scapula. Here you could see again this winged scapula. So this now summary of the brachial plexus injuries. Here you could see these are the various lesions. Let's discuss and divulge into this interesting picture, interactive one. Erb's palsy, the weight test is number one. Here you could see this is the number one upper part of the brachial plexus. The trunks are involved. Which trunks? Upper trunks formed by the C5 to C6 nerve roots. And number two is a claw hand, Klumpke's paralysis by the involvement of the T1 and the C8 nerve roots, and would be the, this trunk, you can say the lower and lower trunk, right? This is upper trunk, this is the lower trunk, number two. And number three is the wrist drop. You could see the posterior card, the brachial plexus is involved. This is the card at the posterior. And number three injury result into wrist drop. I will show you the picture of the wrist drop. So let's see to it, the wrist drop. Here you could see, this is the wrist drop. And then the injury to the winged scapula, here you could see this is the long thoracic nerve injury. And if it is paralyzed, it will result in winged scapula. I've shown you the picture already. Then number five is the deltoid paralysis. Here you could see this is the deltoid paralysis, which is the axillary nerve is involved, right? And number six is the Saturday night palsy. Also, the result is the wrist drop. Here you could see this is a radial nerve injury. As the radial nerve supplies all extensor in the upper limb, so it will be in a state of the hand would be in the state of the flexion at the wrist joint. And then is the number seven, difficulty flexing elbow, variable sensory loss. This you could see this. This is the number seven, musculocutaneous nerve is involved. Number eight is the decreased thumb function with the Pope's blessing. Here you could see this. This is the median nerve injury, Pope's blessing. Let me show you the picture for the Pope's blessing. You could see this is the Pope's blessing. Median nerve injury, inability to flex digits 2 and 3. This is digits 2 and 3, and they cannot be made into a compact fist, right? They would be in a extended position, right? This is a median claw. Coming back to the picture, last one is the intrinsic muscle of the hand. Again, is the clawing ulnar nerve. This should be the ulnar claw, right? These are the branches, the ulnar, median, and the musculocutaneous nerve. And also the radial and the axillary nerve, the 5 terminal branches of the brachial plexus. So this is the Erb's palsy again, and this is the injury. You can go through that, right? Injury is a traction attitude of the upper trunk. C5 to C6 causes the infant's lateral traction of the neck during delivery. I've discussed these all with you in detail. This is a summary, right? In adults, the cause would be the trauma. These are the muscle deficits I told you already, and this is a memory tip for that. Let's go through that. Deltoid, remember the D, and the supraspinatus, infraspinatus, remember the I, biceps brachii. These should be paralyzed, these muscles. B, and here you could see Herb gets dibs on tips, right? So these Herb's paralysis, DIB from these three muscle dib on tips. This is the Vatus tip position. This position, sir. This is the mnemonic. Herb gets tips on tips. This is the functional deficit already discussed with you. The arm hangs by the side. This will be the abduction, lateral rotation of arm, medially rotated, and flexion, supination, arm extended and pronated. This is this summary of the Klumpke's palsy, traction or tear of the lower trunk CA to T1 roots infants, upward force on arm during delivery, adults, trauma, for example, grabbing a tree branch to break a fall. Discuss all these pictures with you of these conditions. Intrinsic hand muscle, the paralyzed lumbrical area, intraossei, thenar muscle, and the hypothenar muscles. The result would be a total claw hand. This is the result, right? Uh, that has been discussed with you already. You can go back and see. Then this is the winged scapula, injury to the C5 to C7 nerve roots. This is the wings of heaven. You can remember from that. You could see this. Muscle deficit is the serratus anterior, and functional deficits, inability to anchor scapula to thoracic cage, cannot abduct the arm above horizontal position. And in the last, this is the thoracic outlet syndrome. Here you could see this. Follow the arrows. These will follow the laser. Injuries to the compression of the lower trunk and the subclavian vessels, most commonly within the scalene triangle, causes the cervical rib, arrows in A. These are the cervical ribs, right? You could see this. Then also its cause is the Pancoast tumor. Muscle deficits are the same as Klumpke's palsy. Would you remember that? Recall that? Yes, I tell you. Yes, that is the clawing of the hand, complete claw. The functional deficit would be the atrophy of the intrinsic head muscle, ischemia, pain, and edema due to vascular compression. This is, I told you already, radial nerve injury. This is the, hand position here and wrist drop. Right? No extension at the wrist due to the injury of the radial nerve. And this is the last picture, the median nerve palsy discussed with you already. Thank you very much for watching my video. I request you to subscribe my channel and stay tuned for more. We have given already a lot of clinical of the upper limb, 18 of them. Thank you very much.